I'm here. Yeah, I went to school for years so that I could tell you more about these things. Please, Carol, let me talk, 'cause I got something to say. Oh please, Carol, just let me talk. Oh, Carol, let me talk, 'cause I got something to say. Oh please.
This is amazing. I've attended a number of these events over the years, and I think this is the largest assembly I've ever seen of the Social Planning Council, so congratulations. Before I begin to attempt a summary, and I'm afraid it's not going to be terrific, because there's so much activity here tonight, a summary of the content, I want to try to identify what I understand to be the basic human values that I trust were motivating what at least most of you had to say this evening. And I think those human values are values that Canadians in general subscribe to, and certainly are reflected in Green Party policies. Those are values of humaneness. Those are values of social justice. Those are values of fostering peaceful relations and cooperative relations with one another. And it's the particular humane values that we need to continue to massage and grow into greater and greater degrees of depth and maturity, so that they inform any particular policies that we were debating quite a bit tonight. I'm now going to shift to what I thought I heard across all the many different groups about particular policies. There are 4 policy areas that I understand to have been the subject of tonight's discussions. The first policy area has to do with social services. And there was a good deal of discussion around health and particularly mental health issues. Mental health is a special concern for me. I am the Green Party critic for mental health in the shadow cabinet of the Green Party. I'm a psychologist. I used to work at the hospital up the road, and I was a professor of psychology for a very long time. Mental health is extremely important because at least 1 out of 5 Canadians at any point in time is struggling with a mental health challenge, and as has already been said, mental health resources in this community are rather inadequate, and that's a shame. But healthcare, besides incorporating mental health, deals with a whole range of healthcare issues, and it would be very difficult to summarize all the specifics of the wide-ranging conversation around healthcare. One way to conceive of what you were discussing about healthcare and in all its complexity has to do with understanding health across the lifespan. Healthcare needs of infants all the way through to those of elders. A second aspect of social services pertains to housing, affordable housing, and accessible housing, and housing that is supported. Does that mean I have 1 minute left? Good grief. Housing that is applicable to the whole wide range of population. Yet another concern about social services that you discussed was childcare. Another policy area that emerged was the social economy, I call it. And we're speaking of income security and the minimum wage and the guaranteed annual income, and the Green Party has proposed that, a guaranteed annual income. That's a fundamental part of our party platform. You also address matters of public transit and infrastructure. Another topic was citizenship, an issue that deserves a lot of discussion. And lastly, democratic reform. As you know, the Green Party has long been an advocate of proportional representation in the electoral process. Yes, we need to improve the nature of the Prime Minister's office, and I am out of time.
I got something to say. Oh please, Carol, just let me talk. Oh.